Cardiac arrest occurs when the heart suddenly stops beating or beats irregularly, leading to the cessation of blood flow throughout the body. This can result from various factors, including arrhythmias, abnormal heart rhythms, heart attack, drug overdose, or underlying cardiac conditions. Cardiac arrest is a dim medical emergency, and swift action is required to improve the chances of patient survival. We will discuss common cardiac medications used during cardiac arrest, including their mechanism of action and nursing implications. Epinephrine. Mechanism of action. Epinephrine is a potent sympathomimetic agent that stimulates both alpha and beta adrenergic receptors. It increases heart rate, enhances myocardial contractility, and causes peripheral vasoconstriction, ultimately improving blood circulation. Nursing implications. Nurses should be aware of the dosing and administration guidelines, as well as the potential adverse effects of epinephrine, including increased blood pressure, heart palpitations, and anxiety. Precise dosing is crucial for preventing side effects and achieving optimal outcomes. Dosage. Intravenous IV or intraserous IO 1 mg every 3-5 minutes during cardiac arrest. Intratracheal, less preferred route, 2 to 2.5 mg diluted in 10 ml of sterile water every 3-5 minutes. Amiodarone. Mechanism of action. Amiodarone is an antiarrhythmic medication that primarily affects potassium and sodium channels in cardiac cells. It helps stabilize the heart's electrical activity, making it useful in treating life-threatening ventricular arrhythmias. Nursing implications. Nurses should closely monitor patients receiving amiodarone for potential complications, such as hypertension, bradycardia, and pulmonary toxicity. Regular electrocardiogram (ECG) monitoring is necessary to assess its effectiveness. Dosage. IV or IO. The initial dose is typically 300 mg, followed by a second dose of 150 mg if necessary after 3-5 minutes. Subsequent doses may be considered if ventricular arrhythmias persist. Lidocaine. Mechanism of action. Lidocaine is another antiarrhythmic medication that acts by inhibiting sodium channels in cardiac cells, reducing abnormal electrical impulses. It is used in managing ventricular arrhythmias. Nursing implications. Nurses should be cautious when administering lidocaine, as it can cause central nervous system side effects, such as confusion and seizures. Regular ECG monitoring is essential to assess the drug's efficacy and the patient's response. Dosage. IV or IO. The initial dose is typically 1 to 1.5 mg per kg. Additional doses of 0.5 to 0.75 mg per kg can be given every 5-10 minutes, up to a maximum dose of 3 mg per kg. Sodium bicarbonate. Mechanism of action. Sodium bicarbonate is an alkalizing agent used to correct acidosis in the body during cardiac arrest. Acidosis can occur due to inadequate oxygen delivery to tissues. Nursing implications. Proper administration of sodium bicarbonate is crucial for preventing metabolic alkalosis. Nurses should monitor arterial blood gases and electrolyte levels to ensure the patient's acid-base balance is maintained within a safe range. Dosage. IV or IO. The initial dose is usually 1 mg per kg, 1 ml per kg of 8.4% solution in cardiac arrest. Repeat doses may be administered based on arterial blood gas (ABG) analysis. Atropine. Mechanism of action. Atropine is an anticholinergic medication that blocks the action of the vagus nerve, increasing heart rate and conduction through the atrioventricular AV node. It is used to treat bradycardia. Nursing implications. Nurses should be aware of the indications for atropine and the potential side effects, including dry mouth, blurred vision, and urinary retention. Accurate dosage and monitoring of the patient's response are vital. Dosage. IV or IO. For bradycardia, 0.5 mg may be given every 3-5 minutes, with a maximum dose of 3 mg. Pediatric dosing is weight-based. Vasopressin. Mechanism of action. Vasopressin, also known as antidiuretic hormone, constricts blood vessels and increases systemic vascular resistance, which can help raise blood pressure during cardiac arrest. Nursing implications. Vasopressin is often used as an alternative to epinephrine in cardiac arrest. Nurses should closely monitor the patient's blood pressure and assess for signs of tissue perfusion to determine the drug's effectiveness. Dosage. IV or IO. An initial dose of 40 units may be administered during cardiac arrest as an alternative to epinephrine. Magnesium sulfate. Mechanism of action. Magnesium sulfate is used to manage specific arrhythmias, such as torsades de pointes and refractory ventricular fibrillation, by stabilizing cardiac cell membranes. Nursing implications. Nurses must be cautious when administering magnesium sulfate, as an overdose can lead to severe cardiac and respiratory depression. Regular monitoring of serum magnesium levels and ECG is necessary to ensure safety. Dosage. IV or IO. For the treatment of specific arrhythmias like torsades de pointes, a common initial dose is 1 to 2 grams diluted in 10 ml of D5W over 560 minutes. The administration of cardiac medications during cardiac arrest is a critical aspect of resuscitative efforts. Nurses play a pivotal role in ensuring the safe and effective use of these medications. Understanding the mechanisms of action, nursing implications, and potential adverse effects of common cardiac medications is essential for providing quality care to patients experiencing a cardiac arrest. Through accurate assessment, calculation, and monitoring, nurses can significantly contribute to improving patient outcomes and increasing the chances of survival in this life-threatening emergency.